Hello, everyone. I hope you're all doing well today. Gender inequality is prevalent in all aspects of our lives throughout the world, such as in sports, schools, the workplace, and the entertainment industry. Today, we will be focusing on gender inequality in healthcare. Here's just a little bit about me. My name is Sejal Singh, and I'm a rising senior at Oakton High School in Vienna, Virginia. With regards to my long-term career plans, I hope to marry my interests in healthcare, global health, and gender equality. These are some of the organizations I am actively involved in and passionate about. I am the founder and president of my high school's chapter of HOSA Future Health Professionals. The mission of HOSA is to empower HOSA future health professionals to become leaders in the global health community through education, collaboration, and experience. I am a four-year member of my school's varsity basketball team, which has also provided me with many volunteer opportunities. Furthermore, I am a member of the Teens Dream CoLab organization and am an active member of the Gender Equality Hub, which I will talk about more later on in my presentation. Here's a brief introduction and an overview to my topic. What is gender inequality in healthcare? Gender inequality in healthcare manifests and presents in a variety of ways, including, but not limited to, access to healthcare, the quality of medical treatment provided, health education, which includes sexual health education, and clinical research. Why is it a global health issue? Gender-based inequitable health outcomes are prevalent in both developing and developed countries. Why is it important? Providing equal access to healthcare allows all individuals to lead healthy lives, regardless of their gender. Gender inequality in healthcare is most prevalent in developing countries with regards to women's health. In these developing nations, gender equality and equity is a major problem in almost all aspects of life. In healthcare, there continues to be a lack of medical professionals as well as a lack of resources for females of all ages. Furthermore, there's an absence of sexual health education for adolescents. Without these resources, the gender bias in these nations will continue to grow, and there will continue to be problems with respect to female health. One of the main areas that gender inequality in healthcare continues to be a problem is with sexual health education and the lack of feminine hygiene products available. In the United States and other affluent countries, many people do not realize that they are privileged with quality sexual health education and access to menstrual resources that those in developing countries do not have access to. Additionally, there's little to no education about sexually transmitted diseases. In fact, the results from a study conducted by the NIH show that it is vital to increase awareness and support for menstrual hygiene in developing countries, particularly in sub-Saharan Africa and Asia. Furthermore, reproductive health and rights continue to be limited in these nations, and many women suffer from complications during childbirth and unintended pregnancies. In fact, a study done by the National Academies of Sciences, Engineering, and Medicine stated that 99% of the 585,000 women worldwide who die each year from pregnancy-related causes are from less developed nations in Africa, Asia, and Latin America. This is an alarming percentage and proves why education is vital to these developing nations and why there needs to be efforts taken to contribute to the lacking supply of resources. In continuation with my previous slide, there are many additional challenges with regards to obstetric and gynecological care. All over the world, there's a stigma surrounding abortion, and for many women, it can even be dangerous for them to attempt to have one. As shown in this map from January of 2021, the majority of developing nations have prohibited abortions. So many women die each year from complications during childbirth that could have easily been avoided and prevented. In many developing nations, female genital mutilation continues to be a big problem, where women are operated on in unsanitary and unsafe conditions, usually to discourage sexual activity. There needs to be an increase in the availability of clinics to provide prenatal care, family planning, and more to pregnant women, as well as information on how to prevent breast, cervical, and other cancers. There also continues to be gender bias in research. Many clinical studies are conducted with the majority of male patients. As a result, there's less data for women in many of the diseases they suffer from. Unfortunately, there continues to be a lack of funding for women's disease research, and one study even went as far as to say there are scientific reasons for excluding women from clinical trials and research. One disease that is particularly under-researched and underrepresented for women is heart disease. Heart disease is generally thought of as a men's disease, but almost as many women die from it each year as men. In fact, one study found that heart disease is a leading cause of death for women in the United States. Unfortunately, the symptoms for cardiovascular diseases present differently in males and females, and as a result, many women are not properly diagnosed and treated. Therefore, the death rates will continue to rise until this inequality is recognized. The last issue I want to discuss today about gender inequality in healthcare is the male mental health stigma. Although there continues to be a stigma surrounding mental health for both genders all over the world, in developed and developing nations, there is an even larger male mental health stigma. Mental illness in males is often overlooked, even though depression and suicide are among the leading causes of death for males. One of the main reasons why mental illnesses in males are overlooked is due to the traditional societal norms present worldwide. Men are supposed to present with a strong front, and they have been taught not to show their emotions or to seek help, as they will then be viewed as weak in society. The traditional masculine norms are the main perpetrator of this issue, and until we can work to eliminate these norms, the male mental health stigma will continue to be a major problem. In conclusion, gender inequality continues to be a huge problem across the world for both women and men. Now, you all are probably thinking, what can I do to help? Unfortunately, I do not have one clear answer for you, and there's not anything that one individual person can do to eliminate gender bias in healthcare. Instead, all people across the world need to work together to eradicate gender inequality in healthcare by advocating for change in both your community and globally, working to promote equity in whatever ways you can, whether that means changing your own personal mindset and behaviors or how you interact with others. It is critical to help the less fortunate, which is why volunteering and donating is always a good idea and a good step towards fighting gender inequality. One of the ways that I've been contributing is with my involvement with the Teens Dream CoLab organization. This group is a network of teens who meet virtually to promote the various United Nations Sustainable Development Goals on a local and global scale. I've become very involved in the Gender Equality Hub, which focuses on promoting goal number 5, gender equality, through a variety of activities, such as group discussions, blog posts, guest speakers, and more. We even have a podcast on Spotify called Overheard, which addresses many important topics with regards to gender inequality in all aspects of life. Here's my Works Cited page with all the studies and resources I used. I just wanted to say thank you to my parents, my peers, and the Global Health Leaders Conference at Johns Hopkins for supporting me and giving me a platform to speak about this very important issue. I have listed my contact information here. If anyone has any questions to ask me or any comments, feel free to reach out and I will be happy to answer them. Thank you so much.